Very interesting situation, and I thought, and I appreciate you being so candid. How far out are you from your surgery?
Well, I had it on February 2nd, so it's like 2.5 weeks.
Okay, 2.5 weeks. So this is who had spinal stenosis, and he'd had already a spine surgery. And luckily, he's allowed us to just, go in and have a look at his situation. So you can see the MRI here. You can see the fusion here at L4-5. You can see the metal there. But you can also see that above the fusion here, there is significant spinal stenosis right above with indentation. There's a pseudodisc bulge there, indentation of the ligamentum flavum, and that was pinching his nerve roots going to his hips and legs. So I've been living with this for at least, what was it, 3 years?
3 years.
Yeah. So we got a CT. We said, gosh, someone who's gone in and had this amount of work, is there enough bone to place an Aurora zip or some type of spacer between these two and stretch it open and take the bulge out? And so we got the CT scan. You can see it over here, and you can see the screws. And indeed, the bone is contiguous, and there's good bone. It's plenty of good bone stock. And so we went to the OR with the idea that we could possibly augment this situation with a tiny little spacer and simply jack open those spaces. And so that's exactly what we did. What I didn't understand and couldn't appreciate really on the CT scan was the degree of loss of height. Now you can see these two spinous processes right here, this bone and this bone, they're kissing. But in reality, they weren't just kissing, they were actually so tight that they had lapped over, they'd shingled over each other. And so what we did is we opened it up, literally, you can see that is what we did. We literally opened it up, 16 millimeters is what we measured, and lifted those two off of each other, opened up the canal, and the result is what?
Terrific. I mean, it has totally eliminated any pain that I had in the way of buttocks, sciatica, or leg pain. I can walk. It's like I never had the problem to begin with.
That's fantastic.
It's hard to believe.
That's wonderful. I'm so happy. Really, so happy. So, and what was the process like? What was the experience of the surgery and all that kind of stuff?
It was very easy, actually. I don't know, the surgery lasted maybe an hour and a half.
Yeah. I think skin to skin was about 42 minutes.
I had some minor pain afterwards, to be expected after you've been surgically cut open, but it disappeared after a few days. In fact, I didn't even need the pain medication after like the second day.
Oh, wow.
And 2.5 weeks later, I have no pain at all.
Wow.
I can walk, I can take my dog for a walk. I have absolutely no pain, and I no longer have to go back every 3 months for those epidurals.
Yeah.
I can travel, I can walk.
Yeah.
It's fantastic.
It is fantastic. So let me ask you this question. How long after the surgery did you feel like you would be able to go out to dinner?
About a week and a half afterwards, I took my car down to have it washed.
Okay.
So I don't go out to dinner very often, but I could have gone out to dinner.
Okay. So, healing up okay?
Excellent. The wound healed perfectly.
Mm-hmm.
I've been showering.
Great.
It's, like I said, it's like I never had the problem to begin with.
Okay.
I wish I had that done before I went to San Francisco, because before then I was dealing with the sciatica, climbing all those hills. But now I wouldn't be at all hesitant to do it.
Well, it's amazing, the data, and I'm going to actually go and get one of these models here. This is it. This is what you've got inside you. It's that little bar, and you can see this little bar in there, and those little teeth, there's what grabbing onto the spinous process, but that's actually what you've got
there
right there.
Is some bone, what do you call it, that goes in there, the liquid.
Yes, yeah, so we put some called DBM.
Bone graft?
Yeah, it's bone graft, demineralized bony matrix. So there's actually a fusion in there, so this is not going to come out.
Right.
Yeah.
That's incredible.
Isn't that cool? Titanium, yeah. The Aurora Zip. It's pretty cool.
Do so much.
I know. And there are a variety of ones we use, so we can really kind of tailor these to the situation.
Right.
Yeah.
Well, I like this one. It seems less likely
Good color too.
to cause a fracture too, I think.
Oh, it is, because it holds on. The reason that's true is because the fracture, when it's just resting on the barrel there, then you have the fracture. But these teeth are actually holding into the spinous process. I don't know if you can see that, but they're holding into the spinous process as well, so distributing the load throughout the entire bone.
Right, well, the other ones are just a
Correct.
single like
Correct.
bolt with a
Yeah, and that's why there's also no subsidence, because sometimes the older models, the bone would wear around the actual barrel, but that's not happening with this at all. So
I like this one the best.
I do too. Well, it worked for you.
Yeah, exactly.
Cool. Well, thank you very much. I really appreciate it.
Thank you.
Oh, my.